We're then going to continue with our reaction with the DG of Health. This is Dr. Sandile Buthelezi, who joins us on the line. Dr. Buthelezi, good evening and thank you so much for your time. Firstly, perhaps your own reflections on the life of Jackson Mthembu.
Good evening, Kathy. Good evening, Stephen, and good evening to the South Africans. It's really a sad day for South Africa. Critically at this time when South Africa is really faced with this pandemic, now we've seen the numbers actually turning into the faces that we live with day by day. And we really pass our sincere condolences to the Mthembu family, to South African government at large, to the people of South Africa, and to actually the whole of cabinet. Ubaba Mthembu, as you all know, he was actually responsible for coordinating all the media through GCIS. So whenever the NCCC had taken some decisions, we'll know that then we need to work hard for our ministers to go onto the public and explain some of the decisions that were taken. A very humble man, a leader, a politician, and a man who will be jovial at most of the times, but actually be giving you quite good way forward on what to do. So we are really very sorry as South Africa, but more importantly, it gives us more of a task that we need to now work even harder to ensure that all the South Africans that are demising prematurely, we need to save their lives. We need to work diligently and try and ensure that we really defeat this pandemic. It's a sad day for us in government.
Dr. Buthelezi, you're absolutely right, because one of the things that this death has done is re-emphasize the devastation of COVID-19. We just heard from the Deputy Secretary General of the ANC, Jesse Duarte, who said that the South African government cannot be found to be letting its people down when it comes to the issue of a vaccine. And yet, multiple reports coming out of the last couple of weeks suggest and paint a picture of a government that has simply been unprepared when it comes to the procurement of vaccines. As the Director General in the department, what explanation do you have for the fact that South Africa to date still does not have a single vial of vaccine in this country?
Yeah, maybe let me start backwards and tell you that firstly, all of us did not anticipate COVID-19, and we've been learning as we've been moving. Actually, the vaccine development process has actually been done in an unprecedented manner, where we've seen countries who are actually white, the upper middle income countries, they invested in some of the vaccines even before the phase 1 trials were done. So as a result, they were able then to be far ahead in terms of the queue in getting the vaccines. We started having discussions with some of the vaccine companies, maybe just to clarify, because there's been a lot of said in the media. As early as August, we started having meetings, we signed non-disclosure agreements, and at that particular time, we're just discussing with them that in case the vaccines become successful, you know, in the R&D for drugs, not all the drugs that go through phase 1, phase 2, phase 3 become successful at the end. There's quite a number that actually don't make it through the efficacy trials. So it was difficult at that particular time for us to actually start investing like the first world countries. Some of them actually funded vaccines in vitro trials as they were starting. So that was a bit difficult for us. But when then we knew that there were some vaccines that were being successful, we had already started then working with different companies, but critically we worked through the COVAX facility, and then we then started also having bilateral agreements. And we are actually happy that now that we've got confirmed orders that are coming through, we believe that we will have vaccines very soon, and we'll start actually doing the vaccinations. Let's say we did some investment at an R&D stage, and we invested billions of money, and then that particular vaccine was unsuccessful. We will be talking a second story here. The South African government have been thrown money into the drugs that did not become successful. So it's a very difficult to balance actually, because you need to you really need to invest in something that has not yet been successful. There's a difficulty that the government was facing.
So did Kenya invest billions of rand into the development of some of these trials? How come they were able to get 24 million doses and yet we don't?
Yes, well, I don't know the case of Kenya, but if they put in money before the vaccine was successful, that was investing at a risk of a country. So it really depends on a particular country if they are willing. I mean, if you look at vaccines like Moderna vaccine, the US spent a lot of money when they were at the very early stages of the trial. So it's a very difficult scenario to deal with, especially in a country where you've got Public Finance Management Act. You really need to ensure that you are very prudent in terms of managing the public resources.
Of course, one of the difficulties comes because just this week we had News 24 reporting that health officials in some negotiations with pharmaceutical Pfizer simply were not responsive to conversations around the procurement of vaccines. And yet there now seems to be a conversation that has resumed with Pfizer to try and secure a supply of some of their vaccine.
Yes, actually, if you can go today, we've got a statement from Pfizer correcting that in their own website. They sent that statement to me and the minister to correct that narrative because it's not correct, and we wanted them to correct it because our negotiations with Pfizer started quite a long time ago, and we were meeting with them. We signed non-disclosure agreements as early as September just to ensure that we continue discussing whilst watching the progress in the trials themselves. Again, Kathy, this is a very difficult scenario because it is unprecedented that countries actually spend money, big money on drugs that have not yet been proven to be successful. But of course, we understand that dealing with also an unprecedented scenario, it calls for some unprecedented actions from some of the countries, and it worked for them, unfortunately or fortunately.
And you know, I think that, Dr. Buthelezi, a lot of people have an appreciation for the moment that we're in and an appreciation for the difficulty of decisions that you as officials in spaces of influence need to make in this moment. But the reality has also been that there has been very little transparency around conversations of a vaccine. You've mentioned the word NDA about 3 times in just this interview, which probably contributes to the problem that we're in right now, that there's limited information and people simply don't trust that government is going to be able to, number one, bring those vaccines into the country, and secondly, have an effective vaccine rollout program in time to save as many South African lives as possible.
Yes, unfortunately, that's the way how business works. When you actually, you've got many vaccine companies, and on their side, if they want to protect some of the information, critically the information that is price sensitive, they actually expect us to sign these agreements. They actually give this. We don't even draft these agreements. These companies give us these agreements. We go through them, and for us, for the sake of progress, to be able to get further details in their discussions, we then sign them because otherwise they are unable to even start talking if we've not signed these agreements. For them, it's a business. For us, it's saving lives. So we need to balance these 2 issues because, again, we'll be sitting with a different narrative today. Let's say we say, no, we're not signing this non-disclosure. They say then, okay, bye-bye. And in this instance, most of these companies, they know that we are so desperate. So we try our best to get as much information so that we make quite good decision and we are able to go to our own treasury and say, this is what is available, these are the costs, and this is what is going to happen from our side in terms of the orders. So it's really a difficult situation, Kathy. I do agree that South Africans deserve to know more, and I believe at the right time they will know more, because we are actually at the mercy in some of the instances of these companies.
Dr. Buthelezi, what is the date that the first dose of vaccines are going to arrive in the country?
Yes, we've got it in writing. We've done our payment to Serum Institute, and we've been told that as soon as it reflects on their account, which will probably be within a day or 2, since an international payment, they will do the shipment, which will take about 5 days. So before the end of this month, the first batch of the drugs, according to the discussions that we've had and is in writing, will be at OR Tambo International Airport.
But what is the date? Surely there must be a date that you're expecting them to arrive, because that immediately speaks to the kind of rollout plan that the department is working on. So which date are those vaccines going to be arriving in the country?
Yes, okay, thank you very much. The payment that we've done, we expect that it appears on their bank account earliest by tomorrow or latest by the weekend. And they've said that as soon as it's in their account, the shipping starts and it takes 5 days. So our expectation is that by the 29th, 30th of this month, we should have the shipment in the country at OR Tambo International Airport. But again, that's dependent on our agreement with them and based on the timelines that they have given us in terms of the signed advance purchase agreement.
So in terms of the plans for the vaccine rollout, we hear from the different premiers of some of the provinces that there hasn't been communication yet from the health department around when exactly they should expect receipt of these vaccines and how the rollout, in particular to healthcare workers, is going to work.
Yeah, well, unfortunately, I can't talk on behalf of premiers, but the heads of Department of Health, because I chair the Committee of Heads of Departments, I met them as late as yesterday at 8 o'clock, and they have all the information. They have been working on the plans with us. So it's up to them to communicate to their premiers, because that's unfortunately at my level, there's a discussion that we have with the heads of departments. So there's a discussion we've had and we've drawn up, and they know exactly how, when it arrives, customs clearance, the QA testing, where does it go to central, and then how does it move from there then to the regional warehouses for us to be able to start with the vaccination.
How long is it going to take for you to vaccinate the healthcare workers of the country?
Yeah, the first phase, we have actually targeted that we should be able to do it within 3 months, even finishing before that, but we've given ourselves 3 months to be able to finish vaccinating the healthcare workers, both in the public and private healthcare sectors, using multiple platforms that we've put in for us to be able to reach as many people as possible.
And just a point of clarity, we're expecting about 1.5 million doses to arrive. We have 1.2 to 3 million health workers in this country. You need 2 doses, so that effectively means that only about 750,000 health workers would be able to get 2 shots of this vaccine. So how is the government going to be approaching it?
Yes, we're working on that. That is one of the difficulties that we have, that we are trying to finalize the Serum Institute, but they have promised us that as soon as they receive the first payment, they will confirm the second order that we're supposed to get. But we're not only counting on the Serum Institute, we are quite advanced with Pfizer, we are quite advanced with Johnson & Johnson, even though Johnson & Johnson will only start production a bit later after they've released their phase 3 efficacy data for the drug. So you are actually correct that we will need to, when we start, we will need to work towards up to 750, and then watch if we're getting the doses. We'll be pushing to get more doses as soon as we can. But Pfizer, where we are, they've actually promised us that they will be able to give us some doses quite quicker than we expected. So we think then that will be able to cover the deficiency, to cover all the healthcare workers. We are quite aware of that one.
So given the delays and just listening to you in terms of the timelines of how long the rollout may take, if it's for health workers, it's going to be 3 months. I can only imagine what it's going to be for the rest of the 40 million South Africans that you also want to have vaccinated before the end of the year. So realistically, what can and should South Africans expect when it comes to their dose of vaccines arriving? These are for phase 2 that will be accessible to more South Africans.
Yeah, the big issue is to ensure the steady supply of the doses, which is not only a problem with us. We'll note that a number of countries are actually now having a problem because the flow of the doses from the manufacturing have not as forthcoming as they expected them to be. So that's what we're working on. But we believe that as the manufacturing capacity increases at the different manufacturing plants with the different vaccines that we have, the things are going to move a bit faster. For example, the COVAX have not even given us the dates as yet on when we're going to start getting what we've already paid for with COVAX. So we will be able to move fast as soon as we know that the supply doesn't stop because of the manufacturing deficiency in the different factories. But our plan is that we should be able to vaccinate a minimum of 40 million South Africans in 12 months. And our plan, our rollout plan is based on that. And we've worked out how many vaccinators we need to do that and how many vaccinations should we be able to do per day at the different centers that we've set up, both in the public and the private healthcare sector. So we hope we can be able to do that as long as we can be guaranteed of the supplies coming in at the right time for us.
Let me just leave it here, Dr. Buthelezi, because at the end of the day, it sounds like a good plan. But if you can't even tell us when the second dose of vaccines will arrive for the rest of the health workers that won't be part of the 750, or even when the dosage for the phase 2 of government's plan will be effective, it's basically a promise to South Africans that does not have a deadline. It doesn't have a delivery date. And yet you're still expecting people to trust you.
Yes, it's a difficult one, Kathy, let me say, but the way we are doing the discussions and negotiations with the companies, until things are, like, for example, we can say with the Serum Institute that the first batch is coming by this date because we've done the payment. With the other companies, once we've done that, we've signed in black and white. For now, we've signed term sheets, and we're working on advanced purchase agreements that we need to sign, and then we'll be able to let the South Africans. But we're just saying that we're prioritizing this. The president is actually leading this. That's why he set up the interministerial committee, because it's a priority for us to ensure that everyone gets a vaccination that they need.
Dr. Sandile Buthelezi is the Director General in the Department of Health. Thank you so much for your time tonight, Dr.